the term dry drowning and secondary drowning and wet drowning has actually been replaced by the World Health Organization. Now it's just called drowning. But it's because there's so much confusion associated with it. But what we know is dry drowning is when a kid or an adult takes a small amount of water or fluid in through the mouth or the nose, and that fluid actually causes a reaction in the upper airway. And what it does is it actually closes off their windpipe and makes it very difficult for them to take air in, which means they're unable to get oxygen in. And so that usually happens, within an hour after exposure to to the water. Usually, the biggest ones are difficulty breathing, or increased respiratory rate, or more difficulty with breathing. Coughing is a very common sign of distress. A change in voice, a change in behavior, signs of them not getting enough oxygen. You see it across the age range. I think kids spend more time in the water, so we probably see it more often in kids, but adults aren't excluded from this being a possibility. I think if you have a kiddo that's has difficulty breathing or lots of coughing, especially after being in the water, the best thing to do is to bring them to medical attention or to come to the emergency room. If you're suspicious and it's and they have mild symptoms, then appropriate to call your pediatrician or family doctor and discuss it with them. But any signs of distress, I would bring them to the emergency room. There's no direct treatment for drowning. It's supportive care, supplying medications and devices to help the patient along until they recover from that insult, of the drowning. I think keeping a close eye on the kids, especially looking for signs of respiratory distress or difficulty with breathing, and then knowing to call your pediatrician or bring them into the emergency room as quick as possible. With dry drowning, or the closing of the upper airway, it's going to be within an hour. It can be immediately after getting out of the water, but usually within an hour. Whereas secondary drowning, where the actual insult is fluid getting into the lungs, and then the problem being from exposure to that fluid in the lungs, that can be as much as 24 hours after the ingestion of that water.